and collected, but 24 hours ago when I first got the phone call, I mean, I was bouncing off the walls.
For Andy Sandness, this is the life-transforming event he's dreamed of for years. And for years, a diverse, multidisciplinary team of medical specialists has immersed itself in exhaustive transplant research and preparation to make it possible.
A face transplantation is a combination of so many other procedures that we do, including eyelid surgery, jaw surgery, facial nerve surgery.
At the time of the transplant, we had 9 surgeons operating. We used over 40 operating room staff, scrub nurses, circulating nurses, perfusionists, and so on.
It's extremely exciting, and even before we listed our first patient, it was really a very growing experience to see so many different disciplines come together.
I've been to big cities and I've been to, little towns. It just draws you back in here. This is always home for me.
The goal is to help people like Andy, a 32-year-old oil field worker from Wyoming whose severe injuries required more than conventional plastic surgery and reconstruction. Andy's struggle actually began as a battle with depression and a regrettable attempt to take his own life with a high-powered rifle.
You know what? I was stupid and I made the wrong choice, and now I'm paying for it for the rest of my life.
Ten years after that fateful act, however, Andy was given a rare opportunity. Only a few dozen face transplants have ever been attempted, and perhaps none as intricately challenging as this one, which involved virtually every tissue below Andy's eyes.
The entire lower face, including the nose, the jawbones, the zygoma bodies, the skin all the way in front of the ear, down to the chin, and the teeth.
Leading the team was plastic surgeon Dr. Samir Mardini, an expert in craniofacial and microsurgery, and director of face transplantation at the Issam and Dalal Obeid Center for Reconstructive Transplant Surgery at Mayo Clinic. He describes the operation as a series of highly complex, interconnected procedures. Among the most critical, meticulously mapping and preserving vital facial nerves on both Andy and the donor.
Because we're bringing in all the functions of mouth closure, smiling, lower lid depression.
Dr. Mardini says there were literally thousands of such steps to coordinate. A collaboration with medical modeling engineers contributed greatly to both the planning and the execution.
Using this technology of 3D modeling, printing, virtual surgical planning is extremely beneficial. They would have cutting guides for us that we would clip on the bones. They would give us the exact location of the cut, the exact angle of the cut. So when we took the donor's face and put it on the recipient, it would fit perfectly.
Meanwhile, other transplant patients also had a stake in the priceless gifts being provided by the donor of the face.
The donor is a solid organ donor, and you don't want to do something that compromises the ability to obtain liver, kidney, heart, lung.
Ultimately, the face transplant alone would require a surgical marathon of 56 hours to complete.
Okay, just here, you take the mirror.
After 3 weeks of healing, Andy was given his first glimpse in a mirror.
Wow.
Still recovering and not yet able to speak clearly, Andy scribbles his first impressions on a notepad.
Far exceeded my expectations. You don't know how happy that makes us feel.
Birch bark.
Birch bark.
As clear as day.
Ultimately, success will depend on more than just the steady hand of surgeons.
I boiled the peas.
I boiled the peas.
There are speech therapists and counselors, plus the lifetime of medications and monitoring required to prevent rejection, which is why the Mayo team had to feel certain that Andy fully understood the risks and was committed completely.
There's an intense medical regimen, be it a face transplant, a kidney transplant recipient, or a pancreas transplant recipient.
Wanting the most natural look possible for Andy, after several months of healing, Dr. Mardini performed an additional surgery to refine his appearance, speed up the regeneration of sensory nerves to his cheeks, and improve his tongue function.
And I was absolutely blown away by the results.
As for Andy, he says there is no doubt his long road to recovery was definitely worth it.
I just feel like a normal person, walking around outside, go to the shopping malls. Nobody asks any questions, nobody stares. Feel like another face in the crowd. And now with this transplant, I just feel more comfortable, more confident in doing these things.
That's easy to understand when one considers the face that Andy now finds looking back at him in the mirror. Naturally, his heartfelt gratitude extends beyond the dedicated team at Mayo Clinic.
Without the donor and the donor family, none of this is possible. I can't say thanks enough to those people for what they did, what they gave me. Yeah, I'm just looking forward to getting back out into the world and doing the things I missed out on. I missed out on 10 years of my life. I'm really excited.